Hello and welcome to Dentrix Does It. In this video, you'll learn how to generate lists of patients due for continuing care, which is sometimes also called recall or recare. Dentrix offers a powerful and flexible continuing care module which can provide reports. Access the module from the appointment book by either selecting the continuing care icon from the toolbar or choose the File menu, then Continuing Care. After the module loads, click on the Views menu. You can run a one-time report by choosing Temporary View. This area will allow you to create a report that can be viewed now, but the settings will be forgotten when you close and reopen the module. The type field should be set to the type of continuing care you want to see. You may select any one type or all. With CC, we'll find all patients with an assigned due date for the continuing care type that you selected above. Without CC would result in all patients who do not have a due date for the continuing care type that you selected. If you have applied statuses, you can search for patients using specific statuses using this menu. The status should be set to all for maximum results, and I'll show you later how you can use continuing care statuses more efficiently. Scheduled appointment allows you to view patients who have appointments that are attached to this continuing care type, those without appointments attached, or to show all patients regardless of whether or not they have an appointment. Sort order allows you to determine how the report is sorted. Use the page up or page down key on your keyboard to change the priority of each setting. For example, by moving patient name to the top, the report will sort alphabetically. By moving due date to the top, it will sort chronologically by the patient's due dates. Here in the due date section, because I selected a temporary view, it makes sense to use a due date range and then enter the possible date range. Type the actual dates from and to. Most of the time, you'll leave billing types set from all to all unless your office actively assigns billing types to patients and you have a specific need to narrow down the results. Prior treatment date span refers to the last time the patient was seen for that continuing care type. This should typically be left all to all. Last visit date span refers to the last time the patient was in the practice for any type of work. This should typically also be set from all to all. Provider can be tricky as it's based on the provider assigned to the patient in continuing care defaults, not to the more commonly thought of Provider 1 or Provider 2 assignment. For maximum results, it should typically be left from all to all. Click OK and your report will be generated. That was a temporary view. Let's compare quickly the differences in setting up this as a permanent report. You would do this if you decided you wanted an 18-month overdue option to be easily accessible on a repeated basis. Under Views, choose Continuing Care Views Setup. Choose New to create a new option which will appear on the Continuing Care Views menu. Setting up this view is identical to what we just saw earlier with two exceptions. You can enter a name for the view. This name is what will appear on the Views menu. Because you don't know on what future day you'll be calling up this report from the menu, you should not enter an exact due date range. Instead, use due date span is the appropriate choice. For example, to look for patients overdue for a year and a half, choose before 18 months. You also have to select a future date range, so choose after 1 day, which is the minimum amount of time allowed. By using a range, no matter what future day you call up the report, it will search backward and forward in this span of time based on the day that you ask for the information. Save the changes, and you'll find your custom menu item is now available in the View menu. Well, no matter which way you brought up the report, let's look at the options you now have within this module. If you like a good old-fashioned report printed to paper, choose File, Print. Notice too that you also have the option to print mailing labels if you prefer. If you select a name on this report, you can then open the Edit menu and then select it Continuing Care. This performs the same action as if you had opened the family file, double-clicked the patient's continuing care block, selected the continuing care type, and then chosen Edit. But of course it saves a lot of extra clicking to get here. Edit and clear selected continuing care performs the same time-saving action as if you had manually opened the patient's family file, double-clicked their continuing care block, and then selected the continuing care type and chosen Clear. Edit and Selected Patient's Continuing Care acts as if you had manually opened that patient's family file and double-clicked their continuing care block. If the patient does not have an appointment date displayed, double-clicking the patient name opens a new appointment information screen. From here, you could choose more information to investigate the patient and their family, to contact them, or to generally get the information you need to be prepared to schedule their visit. If the patient does have an appointment displayed in the appointment column, double-clicking the line will open that appointment information for viewing or editing. Selecting a patient and then choosing Status allows you to change the patient's continuing care status. You may remember earlier that it was an option to filter by certain statuses when you run these reports. An example of doing this might be you call patients in the morning and you mark several of them as not home. Later in the day, you bring up a report of just those patients who were marked as not home, so that you can continue making phone calls just for this group. The statuses can be customized to best fit your office's needs and usage in the definitions area of Office Manager. And that's how Dentrix does it. For more tips and training, please visit the Online Resource Center.